Good morning, everyone. Good morning. Let's sit down and quiet down now. Now just quiet everyone down now for a minute, please, and we'll get started. Please, everyone. Good morning. I'm David Rich, president of Mount Sinai Hospital. To my right, Dr. Davis, my left, Dr. Charney. I'm going to begin with about 10 minutes of comments about the Mount Sinai Hospital and the progress that we've made in 2013 and the beginning of 2014. There were many changes throughout the hospital that were made in the last 15 months in the interest of improving safety, quality, and efficiency. For example, we moved the pediatric cardiac operating rooms and intensive care units so they were adjacent to the other services of the Kravis Children's Hospital. And several additional projects were undertaken to improve our patient flow and our throughput and to relieve overcrowding in our emergency department. For example, we added telemetry capability to all of the beds in 10 Center. Step-down units were created on GP7 Center and the Kravis Children's Hospital P4. PACU beds on Annenberg 7 were converted to an extended stay unit such that patients did not have to use inpatient beds overnight. KCC 4 North was renovated quite nicely, and we created additional heart hospital beds with telemetry as well. And I think most impressively, in February 18th, we opened a 20-bed observation unit. Its opening was linked to a dramatic decrease in the number of patients awaiting medical floor admission every morning and the amount of time that those patients awaited those beds in the hospital. In 2013, we had multiple surveys from external organizations with very successful results. Both CMS and New York State Department of Health seem to have moved in with us at times. The Joint Commission recertified both our ventricular assist device and our advanced palliative care programs. We had a very successful CMS Title 18 survey. Additionally, Mount Sinai was recognized by the Joint Commission as the first comprehensive stroke center in the state of New York, and Mount Sinai Queens was recertified as a primary stroke center. Next, I'm going to cite some impressive quality data, some really important improvements. This season, for the first time, we vaccinated 82% of our faculty, staff, and students at the Icahn School of Medicine and the Mount Sinai Hospital campuses in both Manhattan and Queens. That is a dramatic increase over previous years and a real statement about the dedication of our staff and our students and our faculty to public health. There were substantial improvements in hospital-wide infection rates from 2012 to 2013. Central line-associated bacteremia rates were down, catheter-associated urinary tract infections, hip surgical site infection, coronary bypass surgical site infection, and we started the Stop Sepsis program. The Stop Sepsis program is an Epic-centered sort of a series of information technology improvements that enable our providers to get earlier warnings about sepsis. This happened in both Manhattan and Queens, and we saw a decrease in sepsis mortality from 28% in January of 13 to 17% at the end of the year, a dramatic increase. Mount Sinai also received a top Consumer Reports surgical safety rating. HCAHPS, which is the patient satisfaction survey from the federal government, showed that inpatient likelihood to recommend increased to the 81st percentile nationally. That puts us at the leading edge of New York State. Hospice bed utilization has grown, and as our palliative care services have expanded and moved upstream within the system, with consistently higher percentages of beds on KP6 occupied by those hospice patients. When I last looked at it, over the last 6 months, 89% of our designated hospice beds are now utilized based upon the hours of utilization. That's a tremendous increase in hospice utilization. And our cath lab has one of the highest safety ratings in the nation, now for 16 years in a row. A fantastic, wonderful series of quality improvements over the years have led to sustained excellence. A large number of infrastructure, information technology, and fire safety projects are underway or were completed this year at the Manhattan campus. For example, nearly all of our buildings are now off of a fire safety watch, which is a tremendous advance for Mount Sinai and a real testament to the system that we have here of really excellent facilities management people who have done just tremendous things to bring us up to the standards which we all adhere to. The boiler on Madison Avenue is being dismantled even as we sit here today. I don't know about you, but I'm very happy about that one. It's funny what gets applause, isn't it? And there was a major growth in our cancer programs and our non-cancer infusions in the Ruttenberg Treatment Center. Notable projects at Mount Sinai Queens involved the launch of EPIC in mid-2013 and groundbreaking for a $150 million building that will show tremendous advances for that campus. There will be 7 new operating rooms, an expanded emergency department, and ambulatory care services to truly reflect what a 21st century community hospital should be. I'm extremely proud of the team at Mount Sinai Queens, where the length of inpatient hospital stay decreased by 0.9 days, almost 1 full day decrease in inpatient length of stay in the first quarter of 2014. Well, full credit to the new management team, Brian Radbill, and the older management team that worked together to really create tremendous spirit at Mount Sinai Queens to move forward and to do wonderful things. Their patient satisfaction is at all-time highs for a community hospital in that borough. The floor teams were very proud of their magnet survey preparations when I was out there last week, and I could not be more impressed by their preparedness and their dedication to quality. There's some notable progress in other areas as well. We've entered into a new collaboration with National Jewish Hospital of Colorado, and we expect to see major growth in our care of patients with pulmonary diseases under the leadership of Cal Powell, our division leader of pulmonary critical care and sleep medicine. And also, we launched a new critical care medicine institute this year in February with the arrival of Dr. Stefan Mayer, and we continue to see major recruitments in many specialties, too many to name, but I will note that urology and cardiac surgery in particular have shown tremendous growth related to those recruitments. Within the next few weeks, there will be consolidation of adult and pediatric neurointervention at Mount Sinai Hospital with the sort of transfer/recruitment of Dr. Alex Berenstein, one of the pioneers in the field of neurointervention. And bringing that together with our own team, led by the departments of radiology, specifically the interventional radiology and neurosurgery, we will have one of the top programs in the world in neurointervention concentrated here at Mount Sinai. This goes along also with the transfer/recruitment of Dr. Sadi Gatan, that will bring pediatric neurosurgery also to this campus, in preparation for which we're building 5 more step-down beds on the P floor pediatric floor. So you will see that we're making Mount Sinai Hospital the center for the most advanced pediatric care in New York City. While I focus thus far mostly on our successes and boiler issues, I want to also talk about some challenges. Patient satisfaction is actually at all-time highs at Mount Sinai Hospital, but frankly, we could go further. When you look at national averages, New York City hospitals have never really been at the forefront of patient satisfaction. We could still do much better as it relates to food, transportation, communication with patients. So let's all focus on that as well. We do have real fiscal challenges related to growing expenses in the face of decreased reimbursement from the federal government. And so one of the things that I'd like people to take away from this talk is that everyone should be an advocate for what we need for academic medical centers and urban health systems to succeed. All of us need to go to our religious organizations, our community groups, to write to our representatives and talk about the challenges that we face as an institution and all of our peer institutions around the nation related to the cuts in federal reimbursement. The 2 midnight rule is something that we need all of your help in reaching out to the government to say this is something which is really hurting Mount Sinai. Disproportionate share payments relate to care that we have to provide for patients who will not be covered by the Affordable Care Act, because we have patients in New York City, because of their fact that they're not citizens, they don't qualify for coverage on under such an act. We in New York State train approximately 1 in 7 residents in the entire nation. So therefore, any cuts to graduate medical education or indirect medical education payments are a direct tax on the state of New York. So to the extent that we can work together and focus outside on advocacy to try to preserve or to restore some of the cuts that we've seen, we will do much better as an institution in being able to fulfill all of our missions. And so how can we focus then as a team and focus internally? We should treat every patient and every visitor as if they're a member of our own family, to constantly ensure the highest levels of care, quality, and service. Every single one of you that work here at Mount Sinai and all of your roles are critical to our successes for the whole health system. We cannot succeed in the face of these obstacles that confront healthcare, both locally and nationally, without your personal dedication to our missions. We're committed to treating patients of all means, and especially those in our community. Not all hospitals share that social mission. I would like to end by personally thanking each and every one of you for your dedication to quality, your pride in your work, and frankly challenge you to do even better. As a team, we'll be even greater despite the challenges that face us. Next month will be the 30th anniversary of my arrival at Mount Sinai. This is my second family. It's probably at least as dysfunctional as my first family. And I love this place, and I know that we can come together and do even better. There are tough times ahead of us, and although I wanted to focus mostly on the positive, I think it is by focusing on the positive that we will overcome those challenges together. And I'd like to thank you all for your attention right now, and to open this up for questions. I'd like to encourage everyone who has a question to go to the microphones in the corridors or in the aisles here, and if anyone can't make it across, I think we do have 1 or 2 microphones that can be passed inside. Should I invite 1 or 2 of you? And please also introduce yourself, since not everyone may know.
Michael Marin, surgery. I don't have a question, but I want to echo a comment you made before about the importance of all of us participating in this growth. I want to relay an experience from this morning. We were interviewing a visiting professor for an important position in Mount Sinai, and he said in the course of his discussion that when he came to Mount Sinai this morning, he walked through the front door and he was immediately greeted by one of the security people with a "Good morning, how are you? How can I help you get to the place where you need to go at Mount Sinai?" This is an individual who's been in multiple institutions around the city and around the country, and he said he had never experienced a situation where someone reached out to him with such energy and enthusiasm to help him find his location. If we're doing that at each of our ports, our entrance sites, at the doors, at the cafeteria, if we're all participating in this, it has an enormous impact on the people you wouldn't expect it would, and it also impacts on our ability to recruit great people, maintain our patients, and deliver the quality of care that we just heard about is happening throughout the institution.
Hi, I'm Emily Sine. I've noticed along the same lines that many of the patients have trouble getting in and out of the hospital on Fifth Avenue and Madison Avenue. And sometimes I drive up in the morning and it's very clogged right there, and it's just difficult for them. I know this is a long shot, but is there any way that you could almost make part of the sidewalk on Fifth Avenue a driveway so that they could drive in and not have that struggle on Fifth Avenue or Madison Avenue, getting with their wheelchairs and everything else in and out? It seems like it's just difficult for them.
Yeah, I understand exactly what you're saying. The City of New York will not allow us to change the configuration of sidewalks to create driveways, but one of the things that we have done with the help of the Coleman Institute is to put more wheelchairs at all of the entrances to try to speed the ability of people to move in and out. And I think that the problem with having the boiler there for effectively the last 12 months was a significant problem on Madison Avenue that will soon be resolved. We have challenges, and we will also work with our TransCare people to make sure that there are spaces for patients to move in and out. And of course, our superb security team will also work as much as possible to help. But you're quite correct, and one of the things that we're working on is to create better signage related to the shuttle buses that we have to the more remote parking areas, and patient flow in and out of the institution is definitely a priority. But when you see specific problems, I encourage everyone in this group to let us know, whether it's through a supervisor or whether it's by a direct email to one of the people in leadership. We do care about these things, and we want to try to help whenever we can. Unfortunately, New York City does have certain rules, but I think that within those constraints, we can still make things better for our patients. It's a little bit of a challenge to bring people in, but I think that what I would do is suggest that afterwards, since you have some ideas, that one of the things I would do is discuss those with our VP for Facilities, Pat Lamb, and our Director of Security, Tim Bergender, and perhaps some of your ideas will come to fruition. And I just wouldn't want to take up the time of the people here on those specific concepts, but clearly anyone who has good ideas about how we can improve things here, encourage you to share them, even if not in a town hall, with email or in other forums afterwards.
Hi, my name is David Connor. I'm the nurse manager for the surgical ICU and the new observation unit. One of the challenges that Mount Sinai we constantly face is throughput of patients. And I'm wondering how we will be utilizing, or if we'll be utilizing, the other campuses to relieve or increase the volume of the patients who come through our doors, if that's a possibility.
Well, we actually have a policy which enables us to move patients between the Mount Sinai Manhattan and Mount Sinai Queens campuses, specifically related to that issue. It is an issue, though, because patients and their families and their providers are not always in favor of moving people. People will often come to a campus because they want care that's somewhat local to their family or their community. And so St. Luke's and Roosevelt have had a successful relationship for years in terms of being able to move patients around. And I think what you will see is that there'll be more quaternary care moving into Mount Sinai, and hopefully, especially elsewhere in the health system, you'll see that we'd like the community with, for example, in Morningside Heights, to see their emergency department there at St. Luke's is a great resource. So by bringing Mount Sinai quality to the highest levels throughout the system, we would hope that those local communities would go there. But to help with flow and throughput, we are doing a lot of things at Mount Sinai, and as you're aware, David, some of that is related to moving patients out of the ED up to floors when patient beds have been identified without using a full surge policy, and the dedication of our new leadership team in the ED with our new nursing director, Darlene Vaughn, and Carl Ramsey as the system director, and Peter Shearer as the new operational director. We see a new dedication to flow and throughput, and I also shouldn't leave out our new Chief Medical Officer, Vicki Lopachin. I believe that you will see improvements related to better utilization of flow and throughput within Mount Sinai itself as we move patients up to floors in advance of discharges, and frankly also do some improvements in our discharge processes in the inpatient units. So it's a long-winded answer, but it takes many moving pieces to improve that problem, and all of us are focused on that problem, and we share your concern.
But you also raise another important point, and that is we're now one healthcare system, and we are currently developing a strategic plan for all of the hospitals in our system. It's not a hub and spoke model. We're going to have centers of excellence throughout the system at all our hospitals. It means that there's going to be collaboration among all the hospitals. The school since October has brought on 700 additional faculty from Beth Israel, from St. Luke's, from Roosevelt, and the New York Ioneer Infirmary. So we're now a much larger team. We have to think locally in terms of how we can do better at Mount Sinai, but also to think more globally on how we're going to interact, share patients, share expertise, and work together as one of the largest healthcare systems in the United States.
If you have a question, please raise your hand. Dan Hughes, Employee Assistance. This is for the Dean. Could you comment on the impact of the merger on the graduate medical education programs?
We're now one graduate medical education program as well. And so all of the training programs at the hospitals that I just mentioned are now part of the Icahn School of Medicine. We're now responsible for 2,000 residents, which makes us maybe the largest training program in the United States. That gives us lots of opportunities to look at each of the programs, to share the expertise, the mentorship throughout the system. So I think that all of our training programs are going to benefit, where we have leadership now in graduate medical education at each of the hospitals that are working together. So I'll be making some announcements over the next week or so about how the leadership will come together, but it's a real opportunity for all of our house staff and our mentors to even do better than we have in training the next generation of leaders.
Alan Stewart, cardiac surgeon. With Sinai being one of 3 major players in the health systems in Manhattan, with North Shore LIJ resigning itself to being an insurance product, and NYP claiming we put patients first, and branding the institution, if you will, what's the plan for Sinai to position itself within the Manhattan market, and where do you find the unique institutional brand of the health system in the short and long term?
So right now, we're 40% of the discharges in Manhattan. So we're the largest provider of care in Manhattan. So I don't worry about how we fit. But as we think long term, we are thinking about a branding strategy. And part of that branding strategy has to be with the comprehensiveness and the excellence of what we do, which is to say that we can take care of any problem for any age, for any patient. And we can do it in a way that few other places in the country can. So we're going to make that incorporated in our sloganing. And the slogan's probably going to be something like, "For you, for life."
I'm sure you'll be thinking about it, see if you can come up with something better, but we spent a lot of money coming up with that slogan.
We did. We spent a lot of money for outside marketing firms that came up with about 6 or different slogans, and in the end, that's the one that I came up with. Free.
Right.
What I would add is, we're competitive people, and there are several differences as we put our healthcare system together between, say, North Shore and New York Presbyterian. And that is, as I kind of mentioned before, we're going to be a truly integrated system. One system working together, building on each other's expertise. One medical school for all of these hospitals. New York Presbyterian is 2 hospitals, 2 medical schools, 3 separate board of trustees. It's not integrated the way we're going to be. And North Shore is Hofstra Medical School. It's not Mount Sinai. So we can be the best.
Yeah, and other things to think about. We will have an insurance product. I mean, we are thinking all the time. Virtually half the meetings I have in any day, and the previous one I just had, is all about how we prepare ourselves for population management and taking risk. The impetus for this merger was so that we could take risks, that we would have a system that was large enough, that we have 7,000 doctors in our network, and it's not going to be a narrow network. So we will have our own Medicare Advantage product, January 1. We are having discussions right now with WellPoint about co-branded insurance products, and we'll be having those kind of discussions with other insurers as well. We're not waiting for fee-for-service medicine to die and thinking that we will survive on a narrow band of the population that is extraordinarily affluent that can pay almost anything for the health care. We're ready and positioning ourselves for what is going to be the change. New York State is a little bit behind, and that is moving toward taking risk, population management, and being a partner, if not owning our own insurance products. The LIJ product has like a tiny percent of the exchange, which is like inconsequential. So that really isn't very much there at this juncture. I think we will far exceed it when you think already that our ACO has 30,000 something members in the ACO. And we will be able to, within the boundaries of marketing that are set out by regulation, be able to approach them with an advantage product. I mean, that's going to be a huge opportunity for us. So yeah, we're thinking about insurance, and we will have a unique place in the market.
Hi, good morning. Elaine Daly from Telecom. With these mergers and acquisitions, how will this affect me as a bargaining employee? Will there be layoffs?
What's in it for me?
Yeah.
Would you like me to go ahead? Yeah. We, no doubt, in the face of the fiscal pressures, we have to be as efficient as possible. But we have a very large workforce, and there's some natural attrition. People do eventually retire, or some people move away from New York. And so we are dedicated, as we confront the challenges ahead of us, to try to preserve our workforce and our loyal employees. We will have to focus, though, on how we can be the most efficient that we can be. So as we've made changes elsewhere in the system, we will make changes here. And so I think that the best way to approach it is quite generally. As opposed to any one specific position, it's very hard to say what will happen in the future. But when we look overall at what we're going to be doing at Mount Sinai, we want to grow. We want to recruit the best teams of physicians, the best teams of scientists, so that as the reputation of the school and the hospital rise together, we can have even more patient care services here and find that margin, since we don't call it profit and not-for-profit, to support our missions. And those missions are delivered by our employees. So we're dedicated to our employees.
So
That's
let me use that as a platform to talk about labor management relations. We have had for the last nearly 2 decades an excellent relationship with all our unions. We have to realize that any conceptualization of labor management as a zero-sum game is destructive and doesn't focus on really what is our threat. The threat to healthcare is from decreasing revenues that is a consequence of the country at almost every level, including large employers, not being able to afford healthcare. So providers get cut and cut and cut. Over the next 10 years, the Mount Sinai Health System will have $2.1 billion less of Medicare dollars than our current run rate. That's a consequence of provider cuts out of Washington. $2.1 billion. Roughly $200 million a year, which for this system wipes out any margin. What we have to do is recognize that the enemy is not us. The enemy are the payers. And we have to address that together and find ways to be effective cooperatively.
Tom Heyman from Surgery. Can you hear me? Yeah. Some of our competitors, especially outside New York, have expanded into other markets like Cleveland Clinic, Mayo Clinic, the Sun Belt area especially.
Yeah.
Do we have any expectations in the future in that direction?
Well, let's remember something. If you're in Cleveland or if you're in Rochester, Minnesota, the market isn't that big. In New York, within 50 miles of New York are some 50 million people. So if we just did this market really well, we could still do very well. That's not to say that we aren't thinking more globally. We have added to our international marketing, and we have a number of initiatives all over the world, including the Middle East, Russia, and China. We have opportunities that we're pursuing in Florida. We know that the New York Eye and Ear Infirmary and Mount Sinai have a national brand, and we can use that brand in smart ways all over the country. But our focus has not been as national as has Cleveland Clinic and Mayo, because they have to be. But, you know, I would think over time that will slowly change too.
Yeah, but we have to do that in a strategic way. You know, some of Mayo and Cleveland Clinic have done it. Hopkins has tried to do it. Duke has got some initiatives. A lot of those initiatives fail, you know, because you're spreading yourself too thin. Cleveland Clinic has had to cut about 6% of its budget, and some of that was taking some risks that didn't, you know, work out. So it's all about strategic planning and you know, picking the right places to expand our brand.
Over here, Bianca Fleming. I just want to know in what way this merger is affecting nursing overall, especially in the light of trying to advance us towards a even more excellent practice overall.
Well, let me address that for a moment. Under the leadership of a superb nursing team, we're on track for what I hope will be just the most amazing magnet experience when the magnet surveyors come here the first week in June. And the nurses at Mount Sinai have prepared in a way that just impresses me to no end, and also at Mount Sinai Queens. I expect that you will see that the other healthcare entities that we're now combined with, the other 5 campuses, are going to rise to that level. So I think that we serve as an example, and we already see that our leaders in nursing are providing additional support within the health system in various ways, in helping them with patient satisfaction, and frankly even helping with nursing leadership at 2 of our other campuses. So what it means for nursing here is we want everyone here to go on and to achieve the highest levels of excellence, to be among those 8% of the hospitals nationally that have magnet certification, and to show yourselves as the great examples that will inspire the rest of the health system to rise up to your level.
And yeah, Beth Israel has a nursing school, and it just got approval to become a 4-year school. The medical school is starting to interact with that nursing school. We're going to develop a strategic plan for the nursing school. There's going to be a recruitment of a new dean for that nursing school, and nursing leadership here will be involved in that process. And we expect that, you know, if we do the right thing with the nursing school going forward, it will enhance the experience of nursing throughout the entire health system.
If you have a question, please raise your hand. We'll come to you.
Oh, please. It's okay, Sid. Seated questions are always the best. It's okay.
Good morning, Kim from Radiology. I have sort of a 2-part question. The first question is regarding our new master's program that you're offering your staff here. I wanted to know if you're also going to increase the tuition reimbursement so that we can take the master's program.
The tuition reimbursement so they can take the master's program, yeah.
And the second question is, with any merger and acquisition, we also acquire a debt. So I wanted to know how much is that debt and how will it affect Mount Sinai and their employees?
Well, I can talk about the master's program. Yeah.
I can mention the master's program, but you can talk about the tuition. So the medical school has just gotten approval for a new master's program that we announced, and it's a master's in healthcare delivery leadership. We started the process of working toward getting this approval actually about 2 years ago. We did an analysis of whether this would be a popular master's program. We found out there was only at that point 9 schools that had a master's program in healthcare delivery, and we determined that it was an unmet need. given healthcare reform and the changes in the way we're going to be delivering care, we need new leaders who are educated in a very changing environment. So we've got all our approvals. It's a program that I think is innovative. A lot of it's online, so it allows people from all around the country to participate. There are practical experiences associated with it. One of the areas that I think it's going to distinguish the master's program from most of the others, like at Harvard and Dartmouth, a lot of the teachers are going to be leaders, people who actually do as well as think. And I think that's what you need in a program that's going to train the next generation of leaders. So I think it's a very exciting program. We just announced it, and already we've gotten, as of a couple days ago, well over 150 applications. So I think it's going to be a very popular and outstanding program. But there is a tuition associated with it that I think you're going to have to pay.
Yeah. I think that sometimes on a case-by-case basis, there will be a program for certain individuals, but there's not going to be a global reimbursement for this particular healthcare program. But I think what we'll do is we'll work carefully with the School of Medicine to identify particularly promising candidates that may qualify for some sort of benefit. And so a scholarship is something that we would always want to do, and I'm certain that there will be certain Mount Sinai employees that will be chosen for that. I can't say specifically case by case, and then I'll turn over to Dr. Davis. Do you want to address the issue of finances, or should we just say globally, we talk about it every day?
It's a tough issue.
Raise your hand, we'll come to you.
You don't have to be shy. We're very friendly. Look at us. Every single question got an answer, and it was a nice one.
Thank you. Good morning. Jeff Farber from Mount Sinai Care and Geriatrics. Given the challenges that you've described this morning, is there a top behavior or a specific action that everybody in the room can take and bring back to our teams that we can start doing, exhibiting today that would help us to
That's a very, very critical question. I want to answer that. I'm going to give you a prolonged answer. Some people have heard me say this before, and I apologize, but for those who haven't, I think it's useful. If you do a thought experiment and you start to count the hospitals going south from Mount Sinai, just on the east side, we have Mount Sinai, we have Lenox Hill, we have special surgery, we have MSK, we have New York Hospital, we have NYU. Got 6 hospitals within 3 miles of each other, just on the east side. Of those 6 hospitals, MSK is a major brand in oncology, HSS a major brand in orthopedics, Mount Sinai, NYU, and New York Presbyterian are all top 15 US News and World Report hospitals. So you got 5 of those 6 hospitals are extraordinarily accomplished, and they're all within 3 miles of each other. So what does that mean? That means patients have choices. You can have great care in any number of places on the east side of Manhattan. That's just the east side of Manhattan. We got the whole west side, right? There are boroughs around here. There's just a lot of extraordinary competition, right? And today at Mount Sinai, at the end of the day, we'll probably have 230 beds filled of our 1,000 beds, maybe 240, something in that neighborhood. If instead of 230 at the end of this day, instead of 930 at the end of this day, we have 910, we have just 20 patients fewer, 2%. That will make the difference between whether Mount Sinai had a financially successful day or a very bad day. 20 patients determine our fate on any given day. And those of you who thought about this know that those 20 patients are probably the meanest, nastiest people on the planet. And they decide where they can go on any given time. And they've got great choices. So what does that mean for what we have to do? What it means is we really must provide excellence every moment. What we heard from Mike Marin about the security guards has to be something that everybody does in every job they do, every day, every minute. It means that nurses look patients in the eye, sit at the bedside, ask them how they're doing with real care and compassion. It means that doctors treat patients first, and they don't think that they're more important and their schedule is more important than their patients. It means we really, really have to put patients first. When Dennis and I were doing psychotherapy back in eons ago, I know that what we taught a lot to both residents and to our patients was to remember that you can't always be perfect all the time. You can't be that hard on yourselves. You have to give yourself a little bit of leeway. What I'm telling you now as the CEO, no, that's not true. What I'm telling you now is that every day has to be excellent. Every day. You can't come here and get a B. Because if you get a B, there will be 20 patients who will go somewhere else on the east side of New York. And we'll be sitting here in 2 years and we'll be talking about FTE layoffs. And we'll be talking about other draconian things that can happen. Because as the government pulls the revenues out from under us, if we don't capture market share by being better than everybody else, we will suffer a consequence. And what that means is the way that security guard was today is the way everybody has to be every minute. Susan Somerville, who's our new president at Beth Israel, Mount Sinai Beth Israel, said something really profound at her town hall meeting. What she said was, you know, in the 10 seconds before a patient is anesthetized and goes to sleep in the OR, they have a consciousness and attention that is so acute, they remember everything that happens for those 10 seconds. And all of you who've probably gone through some serious surgeries, or even less serious where you are anesthetized and worried, remember that experience. I certainly do. And what she said is, if a nurse or a doctor puts a hand on your arm and says, don't worry, you're in a great place, everything's going to be fine, you'll remember that for the rest of your life. And that's the kind of compassion we have to show, and that's the kind of thought that goes out of our way to be special and to differentiate ourselves. So that's what we have to do, and that's what we have to remember every day.
Very good. So if there are, oh, sorry, we have another question? Yes,
Just
please.
one more.
Yeah,
I'm
yeah.
working with a number of people here at the institution on efforts to improve our greening efforts or sustainability efforts. Is there a thought or commitment to that you can talk about that is supportive of that, or what is your thinking along those lines? We do very, very well here. People just don't realize how well that we're doing.
Well, we actually do many efforts. One of them is the Greening of the OR campaign related to creating different ways of handling waste disposal. And I think throughout the organization there are many efforts. I seem to recall one of our former medical students with the last name Charney leading some of those efforts for the medical students a few years ago. And all of those efforts have been very successful in isolation. And so I think what I would take away from what you said is that perhaps even through a publication like Inside Mount Sinai, we would highlight a lot of those programs so people can be more aware, and areas that have not yet focused on greening of their particular areas can be inspired by those and to work in that direction as well.
Hi, Barbara Zucker-Pinchoff. I wanted to just go back to what Dr. Davis was saying about the need for sort of personal excellence by all employees every day of the week. I want to know what the institution plans to do to support that. We're obviously not in a position to pay people more and more because of all the cuts in reimbursement that you've mentioned. But where does that security guard get the positive feedback that says, you did something great today? Where is that coming from in all of the very, very various departments here, from nursing to engineering to everywhere else? Everybody needs to get rewarded for that, and it's not going to be financial.
Yeah, well, I think when people do that, it's self-reinforcing because they see patients smile. And we all went into this to help people. And I think when you are compassionate and you see the response that it produces, it's self-reinforcing. But it's also about the managers. It's about the unit managers. It's about the leadership also saying, you did a good job today. When I come in the morning, and some of our security guards are particularly exceptional, and I often say, you know, that was a great greeting. That was really nice.
Another shout out to the security guards. So the medical students complete a survey every year, and this year the rating of the security guards was more than our faculty. Now, our faculty did very well, but the security guards were spectacular. Tim said, "Will we pay his tuition?" I'm going to say, "Good try," but let me speak toward the faculty as it relates to patient satisfaction and compassion and so forth. It has become that metric, and it is a metric because we track patient satisfaction at the level of every doctor. So it has become something that we look at, that we care about from the leadership point of view. It's now part of appointments and promotions. One of our faculty tracks is the practitioner track, which is for our faculty who are 80% or more clinical. And one of the metrics that we look at when such faculty get promoted from assistant to associate to full professor is how do they treat their patients? What do their patients think of them? So the reward there is promotion. And it's got to be just part of the ethic of what we do. It's the expectation. It's not above and beyond the call of duty to do great work. It's what is expected here at Mount Sinai.
And let me also add that there are specific training programs relating to that as well. And I want to point out that our HR group in particular has been very successful. I think the biggest success would be the FPA program related to training of the patient care associates, if that's the proper term, but the individuals who greet you when you first come to the desk. And that type of program is what we're moving throughout the system in demonstrating that we can also work with our employees and give them the skills to improve patient interaction and satisfaction in different areas. And so, yes, Barbara, there is some training as well, but I endorse what everyone else has said, that also some of it has to be internal. So we can help give people the tools, but we also would expect that people would internalize those and make them their own goals, and that reward comes from many different ways, and from the internal and from the external.
Hi, I'm Rika Arnon from Pediatric Cardiology. Back to the mundane. I'm up here.
Oh, there, hi, Mike.
Back to the mundane. I know we are handicapped by our physical multiple buildings, and I think we need to give a thought, or maybe you have already, how do we transport patients away from the crowds on the main corridor? Because having been a patient, it's terrible to go into elevator with everybody or to be in the main corridor. And the other thing, while patients are being transported, I think we have to urge the transporters not to talk about above the patients with their friends, to stop and talk about other things. I think it's terrible.
Yeah. Well, let me try to frame it in the positive, and to say that when we see issues, when we see a way to improve things, that's always a chance that we have to make things better for patients at Mount Sinai. We do have one sort of Main Street Mount Sinai underneath, which is the MC corridor, but I think moving people through in a respectful fashion and trying not to crowd patients in on elevators, and focusing with our transport teams and training them to be focused on patients are all things that we can work towards. And so I can take that as feedback as an opportunity for improvement. And, but I don't think that overall our transport services are bad. I think they're overall quite excellent, but we have room for improvement. And so let's take this as an example that when we see something like that, let's reach out. I'll be happy to direct you, for example, to the manager for patient transportation services, and they can receive that feedback on a more just-in-time basis, so they can work with employees and encourage them to do the right thing, and to show that level of compassion that Dr. Davis talked about so eloquently.
I'm sorry, it's me again. Overall, I'm the ear and eye of Mount Sinai because I'm one of the telephone operators. So some of the questions we get from patients is someone who called, they leave no messages, and they call for days trying to get a test results. How do we resolve that when doctors don't answer?
We actually have some relief from New York State on the way. And actually, I think it might even be federal, in that we're now going to be allowed to release all laboratory results into our healthcare portal. So going forward, patients through MyChart will be able to see all of their laboratory results, assuming their age of maturity. And so that will be in place fairly soon, within the next few months. I see that our Chief Information Officer is nodding in the affirmative, so I think I got that one right. Kumar, do you want to shout anything out that I could repeat over the microphone? Yeah. Oh, Ila's here. Okay. And so if we can get let the experts speak on the exact subject, but that it is a problem throughout the U.S. It isn't just a Mount Sinai problem, but I think we have a good solution.
Until recently, New York State did not allow the laboratory to release results directly to the patients. You had to go through your provider to get laboratory results. As of April 1st, they've allowed us to do that. And so there's several measures on their way, and Kumar is a huge supporter of ours in getting some of this done. So MyChart, which is Epic's portal for the patient, will allow you to get access to all of your results in the laboratories, with exception of some sensitive results like HIV. For patients in non-Mount Sinai hospitals, so BI, SLR, they do not use Epic, but we have a plan to be able to use the MyChart portal for also those sites, and Kumar can add more on that.
And just to add to that, we are also launching a patient online portal for the other hospitals as we speak. So there'll be another way for patients to get in and get their lab results. And eventually we want to all migrate to Epic, so we will be having all patients go to the same portal, but we will also give multiple portals at this point.
Very good.
Hi, my name is Francine Faki. I'm one of the surgical medical nursing directors. And just to this point about MyChart, personal experience, took a very close relative to the FPA last week to see a GI physician. And over the weekend, we actually accessed MyChart and had an opportunity to review the labs. The other thing that I want to mention is that our experience in the FPA, as Dr. Callahan knows, because I emailed him, was fantastic. Everybody from the receptionist onward was so warm and friendly and really just made us feel so good, including the physician who took care of us, spent a lot of time educating my family member, and a lot of gratitude goes out to you for that. And just overall, since I have the mic, I just want to say that Dr. Rich has been here for 30 years, and on Friday I'll be here 3 years as a nursing director. And I am so proud to work at Mount Sinai Hospital. I work with such an outstanding group of nursing leaders and nurses, and I feel really privileged to work under the leadership of Carol Porter. And I do appreciate all the support that Dr. Rich gives us, but really it's just an incredible place to work, and I have so much pride in what I do every day. So thank you.
Thank you.
I'm sorry, it's me again. For those people who do not have access to a computer and MyChart, what do they do in that instance to get their results?
We will put them in touch with the physician team that took care of them. The physician, sometimes the physician's assistants and nurse practitioners that work with them should be able to explain to people who are less sophisticated or who need help. But we would always hope that we would be able to do that, and but hopefully we'll relieve the burden on the hard-worked operators related to unnecessary queries about laboratory results, thanks to the efforts of our laboratory and IT teams.
No, actually, I just wanted to also comment that we've also recently, for patients who are discharged from our emergency department, as well as patients that are discharged from the inpatient, when they get their discharge instructions, they will now be receiving, within their discharge instructions, notification of pending laboratory results and information about who to contact with regard to questions. And these are things that will be reviewed with the patients, you know, of course, prior to their discharge, either from the inpatient unit or from the emergency department. Epic has been updated to include that information. The physicians can choose, you know, based on their judgment, what is important for the patient to follow up.
Okay, well, if I could sum up and say that I think that a town hall is a wonderful forum. It's a great chance for people to interact with us. And don't think that the 1 or 1.05 hours per year that a formal town hall occurs is the only time to interact. We are a very transparent and, frankly, a very open leadership structure at Mount Sinai, and whether the information comes via direct email or information that filters up through supervisors and directors, we want to hear from people in this institution. We want to hear about the chances to improve the place. I prefer not always to think of it just as problems, but as ways that we can make the place better. And I would also encourage everyone, again, to leave here remembering all of those important words you heard from Dr. Davis about the dedication and the compassion, but also remember that we have to be advocates for what's right for healthcare in this very challenging time, and we also have to think about ways that we can be the most efficient in addition to being the most compassionate, because we're challenged. All of healthcare is challenged. Just look around us at healthcare systems throughout the nation, even at the hospitals that are in crisis in the outer boroughs and in Manhattan itself. And we know that we have to work even harder to succeed in the healthcare environment of the future. But I have tremendous love and respect for this institution and for the people who work here, and I know that we will get through those more difficult times because of that dedication and because we'll be able to compete due to our intellect and our compassion and everything that we do for quality at Mount Sinai. So I'd like to thank everyone for coming to this town hall.